this decade, we have seen increase or rise in the use of gutka, which is more a chemical form of tobacco. And even in studies which we have seen that gutka is worse than the loose form of tobacco.
Hi guys, this is Mini Divan and you're watching TheHealthSite.com. Today we have with us Dr. Hitesh Singhvi, Consultant Head and Neck Surgeon, Fortis Hospital. Hi doctor, how are you?
Hi Mini, all okay, tell me.
All great, I'm hoping things are well at your end as well.
Yes, same here, just got out of surgery.
Wow, okay. Well, I hope that went well too. But the primary subject of concern for today, doctor, is mouth cancer and the rising cases of mouth cancer. To begin with, let's quickly understand in layman terms for all our viewers what exactly is mouth cancer.
So, mouth cancer is any non-healing ulcer which is there in your mouth for more than 3 weeks. It can be on your tongue, it can be on your inner cheek of your in a part of your cheek, can be on your teeth or on your surrounding mucosa. It can be on the base tongue, that is back side of the tongue, can be on your lip. So there are 7 parts of mouth, and any non-healing ulcer on these parts are called mouth cancers.
So doctor, why is there a sudden increase in the mouth cancer cases specifically these days?
So the increase in mouth cancer, especially in Indian subcontinent, is directly related to the use of tobacco. So if you see, according to Global Adult Tobacco Survey, which was done in 2010, and second it was done in 2016, we see there is an increase in the use of smokeless tobacco in Indian scenario. So, and a decade back, there was more usage of henny or tobacco, which was loose tobacco. And nowadays, in this decade, we have seen increase or rise in the use of gutka, which is more a chemical form of tobacco. And even in studies which we have seen that gutka is worse than the loose form of tobacco. So that is the reason why what we can see is there is a rising trend of usage of these products. They have been marketed in a way in which they are safe and surrogate for smoking, but they are as harmful as a cigarette. That is the reason why we see increase in mouth cancer because of increase in use of these products.
If we are to understand here, which age group specifically is most likely to be wary of mouth cancer or to catch this disease, is there any particular age group?
So age group, previously maybe 20 years back, we used to see these old cancers between the age of 50 and 60. But again, because of use of tobacco and especially these forms of chemical products, the sleeping time, or I would say the duration of carcinogenesis has been shortened. For example, if you are consuming tobacco, which is a loose tobacco, it will take 10 to 15 years to form cancer in your mouth. But because of these chemicals, chemical form of tobacco and smokeless form of tobacco, that duration has been concise to 5 to 10 years. That is the reason why now we have a study from Tata Memorial Hospital which says that now younger people are getting these cancers. So average which was 50, now it is 40. So we have grown 10 years younger in forming of cancer because of these products.
True. Also, having said that, is by any chance, apart from tobacco, if we discuss, are there any other common causes which leads to mouth cancer?
So there are 5 to 6 causes which I can enlist, which can cause oral cancer. Of course, first is tobacco. Second is alcohol. Alcohol is also a class 1 carcinogen. It is IARC approved. That means if alcohol has an independent tendency, it does not require anyone else to cause cancer. Third is areca nut, which is quite predominant in Indian scenario. Like we use supari, even that is a class 1 carcinogen. Fourth is, so these 3 are etiological factors. The next 2 factors are contributory factors. That means the next 2 factors directly cannot cause cancer, but they can help tobacco, they can help alcohol, they can help areca nut to cause carcinogenesis. Includes chronic ill-fitting dentures. That means if you wear any dentures in your mouth, they're not fitting well, because of which there is chronic trauma to your mucosa. Sharp teeth, again causing chronic trauma to your chronic injury to your oral mucosa. and poor oral hygiene, and of course virus, human papilloma virus. But the chances of it causing oral cancer is very minimal, is less than 4%.
And if we talk about the treatment of oral cancer, is it treatable? B, are there any advancements in the treatment with progressive years?
So the question was a little general, but I would like to be positive on that note, that yes, cancers are treatable. They can be cured completely if detected early. So the problem with Indian scenario is we come late on every stage. Even in oral cancer, we see 80 to 90% of the cases they are in advanced stages. In advanced stages, the chances of survival are about 50 to 60%. That means if you operate 100 cases, 60 people will survive for 5 years. But if you operate early tumors, early cancers, then they will survive to 90 to 95%. That is the significance of you being in an early stage if you are a cancer patient and you being in a late stage. The first part of the question was, what is the treatment of oral cancer? The treatment of oral cancer mainstay is surgery. So concept is to remove the cancer with adequate margins so that it does not come back. And because from the oral cavity cancer, the first area where the oral cancer spreads is neck, you also treat the neck, you also remove all the nodes from the neck. And if the part which is removed is big enough, then we'll reconstruct it with some kind of a flap. So our aim now has become not only to increase the survival of the patient, but also to give them a quality of life.
I think this is well put, Doctor. Thank you so much for sharing your valuable insights. And I hope with time people don't take it for granted and perhaps act on it as soon as they feel like there's some problem or there's something which is wrong or different than the usual.
Absolutely. So mantra is, if you're not smoking, please do not smoke. If you're a regular smoker, decrease smoking.
Yeah.
And of course the use of smokeless tobacco. So 85% of all the mouth cancers are because of tobacco. To stop this habit, we'll be able to prevent all the mortality rates because of oral cancer.
Yeah, that's true. Thank you so much for joining us today. Thanks a lot.
Thank you, Minnie. Thank you.